Yes, hello. Hello, how can I help you? Do you have an appointment? Because without an appointment, we cannot help you. Okay, let's see. What is your name? I'm sorry, you don't have an appointment. Right, let me see the system. Unfortunately, you're fired. Hi, let me check. Oh, there you are. An eye exam. Okay, I'm going to look right here, right into my eyes. Okay, great. Now I'm going to look at this finger. Look at another one. Okay, now we'll come a little bit closer. Okay, just try to relax your eye, relax your eye, relax your eye. Okay, great. How many fingers do I show you? How many fingers do I show you there? Okay, how many fingers you see here? And how many fingers do you see there? Okay, now I want you to focus on that side for me, okay? Try not to blink. Okay, great. Look over there. Now you know. Yeah, okay. I'm going to close your eyes, okay? Do you see anything change now? Okay, I'm going to close one more time and tell me if anything changed now. Okay, I'm going to close one more time. Tell me if something changed now. Okay, great. And look at my two fingers. Look at my two fingers. Okay, now come a little bit closer and I'll do this to your eyes, okay? You stay relaxed. I'll just do that myself, okay? Now I want you to do it with your eyes. Shrink it a bit and relax. Shrink it a bit and relax. Shrink it a bit and relax. I'm going to disappear from your vision. I want you to look here and there at my finger. Okay, I'm going to disappear from your vision. Look at my finger and there, here and there. At some point it's going to get blurred. I want you to tell me when it's getting blurred, okay? Tell me when. Okay, when. Okay, don't forget. Tell me when it's getting blurry. Got it. When. Okay, great. I'm going to follow my finger non-stop. Follow non-stop. Okay, great. You're supposed to blink. That's okay. Do not worry about that. You're fired. Wait, look here. Okay, try not to blink. That's great. It's okay if you do that. It's totally normal. Okay, I'm gonna take one step back. How many fingers do you see? One step forward. How many fingers do you see? Is it getting blurred at some point? Okay, I got it. I'm gonna take 2 steps back. How many fingers do you see? How many from over there? Okay, great. Now I'm going to close your eyes. Take a deep breath in. And tell me if this light bothers you. Okay. At some point, if it is, I want you to tell me, okay? I'm gonna check your eye, vision from the top, vision from the bottom, okay, from the side, from this side. Okay, great. I'm gonna close your eye one more time. Okay, tell me if this light bothers you. Okay, I'm gonna put one finger in between your vision. I want you to look straight if you can. Great. Okay. Okay, now look at the chart and tell me if you can see anything from here. Okay, what about here? Do you see anything here? Okay, maybe a little dot right here. Maybe a little dot there. Okay, what about here? Right there. And right here. Okay, so from there, from very close, do you see a dot here? Or there? Or there? Okay, I got it. I'm going to close your eye one more time. Okay, tell me if this light bothers you, okay? I want you to look at my finger, and with this light, I'm going to examine it all the time. Look here, it will go there and back, there and back. Okay, we're going to switch. Look right here, there and back, there and back, there and back. Okay, I'm going to come a little bit closer. You can just look forward. Do not look at the light. It can be too bright. Now shrink it and relax. Shrink it and relax. Shrink it and relax. Okay, we're going to switch. Shrink it and relax. Shrink it and relax. Shrink it and relax. I know there's another word for shrink it, but I just like it, so here we go. Okay, tell me what you see right here. Right here. Okay, do you see the same thing on another side? Right here. Okay. Do you see something right here? Right there. Okay, if I turn it to this side, is there anything on this side right here? Okay. Well, tell me if you see any letter here. For example, right there. Do you see anything? Okay, if you go down, do you see any letter there? Okay, right here. Any letter there? Okay. Do you see anything here? Anything here? Okay, and on another side, is it the same thing? On this side. Okay. One more. Do you see anything here? Okay, do you see any resemblance with this kitty cat? Yeah? Between you and this kitty cat, do you see anything in common? Okay, other than cuteness. Okay. Great. I'm gonna put this on your eye, just like that. You're gonna look at with the light. With the light. Okay, and they're high. Let's do it one more time. One more time. Oops. Okay. Tell me if you can see this color right here. Okay. What about color here? Okay, color right here. Do you see color right here? What about this one? This one. Okay, what about this one? And this one. Is this blue and this blue look same to you? This orange and this orange look same to you? This pink and this pink look same to you? On the other side, this blue and this blue look same to you? What about this orange and this orange look same to you? And this pink and this pink look same to you? Okay. I'll ask you to look on the circle all the time, okay? Into the circle. Okay, great. Into the circle. Into the circle. Okay. Into the circle. I'm gonna give you a little instructions. Please look to the right side. Oh, okay. Now slowly go to the left side. Great. Can you look a little bit up? A little bit up. Okay. Now a little bit, slightly, a little bit down. Slightly tilt your vision down. Okay. Now look to the left. Slowly. Great. You're doing great. Look to the right. Slowly. Okay. That's good. Look a little bit up. Okay. And a little bit down. Okay. Now I'm going to show you one item, and I want you to focus on this item right here. Okay. I'm going to be examining your eye. Okay. Look at this item all the time. All the time. Okay, great. I like your reaction. That's good. Okay, look all the time to this item, please. You're doing good. Yeah. All the time. Okay. Here. Okay. Right here. Right here. Okay, with my fingers, I'll just like to examine the area all around your eyes, okay? Okay, so I'm just gonna give a little tippy tap on the corner. Tippy tap on the corner, and that's supposed to feel so okay. Is it feels okay? That's great. A little bit on the top, just like that. A little bit on the top, just like that. Feels fine. Okay, I'm going to close your eyes, and top here, do you feel where? Top here, do you feel where? Okay. Is it on the top or on the bottom? Let me help you. On the top or on the bottom? On the right side or on the left? On the right side or on the left? Right there. Right there. Okay. And now I would like to check your hearing test, okay? So with this tool, I'm gonna just tap around your ear, and you tell me if you can feel the difference between. Okay. Do you feel? Okay. Do you feel it hard or soft? Got it. Okay. What about here? Okay. Let's try one more time. Do you feel it? Okay. What about now? Okay. And one more time. One more time. Okay. I'm going to cup your ears just like that. Do you feel the difference between me talking when your ears is cupped or when they're not cupped? So I'm just gonna cup it, trying to talk at the same time, and let's see if you can hear the difference. If you hear the difference, I want you to let me know. Okay. I don't have anything else to say. So I'm gonna cup and I'm gonna whisper the number, and I really need you to repeat that number, okay? Let's see. Okay. 38. I'm sorry, I don't understand what I said myself. 59. Okay, yeah. 36. Great. 22. No. 28. 22. Okay. 36. Okay, now I'm going to leave your ears alone, and I'm gonna whisper to the sides, just like that. Okay, 22. Perfect. 38. Okay, 28. So I do think you have a little problem with your hearing. 22. 38. I think 38 is my favorite so far. 46. Okay. 22. Sorry. Okay, tell me if you can hear this. That's right. Does this sound the same on this side? Okay, do you hear that? Okay. Can you tell me where sound's coming from? Okay, where sound's coming from? You could guess, right? Okay, right now. Right now. Okay. I'm going to look into your ear. Okay. Somebody do need clinic. Yep, I think it's been for a while. I think it's been a while. That's right. Okay, yep, definitely, but I don't see any problem. But I think you do have a problem with your hearing. Let me see one more time. Okay. Okay. I'm not sure. Okay. I have two tweezers. They're very similar, but there is a difference. Now I want you to tell me if you can hear the difference, or maybe I'm lying. Maybe there's no difference at all, so just take a moment. Okay, I'm just gonna tweeze it and tell me if it sounds the same. Okay, you hear that? You hear that? You catch the difference? Great. So if I'm gonna go, do you hear the sounds moving? Do you hear the sounds moving? What about now? Okay, tell me if sound's moving or not. What about now? What about now? Okay. Okay, do you hear that? And that? Okay, can you tell me the direction where sound's coming from? Where sound's coming from? Of course it is. Where sound's coming from? Where sound's coming from? Okay. Does the sounds the same to you? Okay, and tell me where it's coming from. What about now? And now? Okay, I'm gonna take that and check one more time, okay? Don't be afraid, everything is fine. If not, we're gonna fix it. I promise. Okay. I would like to examine your ear with my hands if you don't mind. So I'm just gonna tap it lower. Do you feel where I'm tapping? On the top of your ear or on the bottom? Okay, what about now? What about now? Okay, what I'm doing now? That's right, and now? Okay. Okay, do you see this hammer? So I'm gonna tap on this hammer a few times with my finger. I want you to count how many taps I did. Okay. Okay. That's right. That's right. Okay. Sure. Okay, I'm gonna tap behind you. Okay, right in front of you. Okay, on the top of you. I'm gonna close your eyes at the same time, don't mind. Okay, here. And here one more time. That's too many. Okay. I'm going to make sound, and I want you to tell me when the sound stops. Great. Let's try one more time. One more time. It's gonna go all over you, all over you, all over you. You can stop at any moment. Maybe I'll be still talking at you. Great. Okay. Okay, and now I'm going to just count because I don't know what to say, and I want to make sure that you can hear when it stops. 1, 2, 3, 4, 5, 6, 7, 8, 9. Great. Now I want you to say, now I want you to guess what the sounds like. Anything else, maybe? Okay. What about this one? Perfect. You're right. Let's see if you can tell me what this is. I'm sure you have more than one option. Well, you did great. Here you go. Well, can you tell me what this sounds like? Okay. Okay, let's see if you can tell me what this sounds like. One more time. Are you sure? Yes, I'm sure you had a cranial nerve exam. So what do you think about your peripheral vision? Do you have any problem with your peripheral vision? Okay. What about double vision? Did you ever have double vision? Colorblind vision? Okay. Any problem with your facial muscles? Okay. Now I want you to raise your eyebrows as high as you can, and I will try to pull them down. Don't let me do that. Okay. Great. Open your eyes as wide as you can. Okay. Okay, relax. Open your mouth. Don't let me close it out. Try to close it. Don't let me do that. Great. Okay, I want you to pull your cheeks out and hold them there. Okay, great. Okay, now I want you to look to the right, look to the left, to the right, to the left. Okay, up and down. Okay, great. I'm gonna close your left eye. Tell me how many fingers do you see? I'm gonna close your other eye. Tell me how many fingers do you see? Okay, let's go to the charts, okay? Okay, I want you to look right here and tell me if you can see this number. What about this number? What about this number? And number right here. Okay, what about number right there? And number right there. Okay, let's wipe to the letters and tell me if you can see letter right here. What about this one? What about this one? What about this one? I'm sorry, I'm rushing a bit. I'm so sorry. Okay. What about this one? Yes. This one. This one. This one. Okay. Now tell me if you know what this is. Yes, what this is. Okay, I want you to tell me whenever you see pineapples disappear from your vision. Okay, whenever is strawberry disappear from your vision. Okay, whenever is pineapple appear in your vision, tell me. Okay, whenever strawberry appear in your vision, tell me. Now I want you to look only into my eyes. Don't move your eyes anywhere. Okay, look right here. Tell me whenever you see strawberry disappear from your vision. Okay, whenever pineapple disappear from your vision. Okay, tell me whenever strawberry appear in your vision. It's gonna come very close, okay? Whenever pineapples appear in your vision. Okay. I want you to follow my light no matter what. Just look at my light. Okay, great. I'm going to close your upper vision and I want you to, with pointy finger, touch my nose. Touch my nose. I'm gonna close your bottom vision and I want you to, with pointy finger, touch my nose. Touch my nose. Okay, I'm gonna close your right eye and with your pointy finger I want you to touch my nose. Okay, I'm gonna close your left eye with your pointy finger, touch my nose. Okay, I'm going to close your eyes. I'm going to close your eyes. You can keep your eyes open if you want. And tell me if this light bothers you whenever I open. Okay, what about now? Now, if it bothers you when I open. Okay, I'm going to close one more time. Tell me if this light bothers you when I open. Okay. I want you to look at the hammer. Look at the hammer. Okay, great. Look at the hammer. Nice. I will examine your pupil. Come a little bit closer. Try not to look at the light. It can be very, very bright. Okay. Your other eye. Don't look at the light. It can be very, very bright. you think about your colorblind vision? Well, let me tell you, if you don't have any problem with that, tell me, do you see number here? Or maybe letter here? Number? Okay. What about number here? I want you to close your right eye and tell me if you can see number right here. Okay, I want you to close your left eye, open your right eye, and tell me if you can see number right here. What about here? Okay, I'm gonna take one step back and tell me if you can see number right here. And here. Okay. Okay, do you see color right here? What about here? What about here? And here? Here? And here. Okay. Okay, I'm gonna have my 2 cotton sticks and I want you to look right at me. Okay, tell me whenever you see on your left peripheral vision cotton stick. Okay, look right at me whenever you see on your right peripheral vision cotton stick. Okay, look right at me whenever you see cotton stick disappear from your left peripheral vision. Let's try one more time. I was talking too long. Disappeared. Okay, whenever it's disappeared from your peripheral vision. Let's try one more time whenever it disappeared. Okay, I want you to... No, that's okay. I'm gonna close your right eye. Okay, you tell me whenever it's appear in your vision. The left eye, whenever it's appear in your vision and disappear. Okay, whenever it's appear in your vision and disappear. Okay, great. Now I would like to examine your face. Okay, I will just stop here. Do you feel it? Okay, right here. Do you feel it? Great, right here. Do you feel it? Okay, on your forehead. Do you feel that? Okay, now here and here. Okay, right there. Right there. Okay, I'm going to close your eyes and you tell me where you feel it. Okay. Yep. Well. Yep. Okay. Okay. Now, do you hear that? Do you ever have a problem with your hearing? Who told you that? Wait a second. Have a look. No, okay. A little cleaning might need. But so far I don't see any problem. So forget about that. Tell me if you can hear this. You can hear this. Okay, now I want you to look at my finger. Look at my finger. Do you hear a sound on your right or left? Okay. Look at my finger. Do you hear sound on your right or left? Okay. I want you to look at this chart for me. Look at this chart and tell me if you can see this letter right here. Next one. Next one. Next one. Next one. Well, let's see if you can read this one right here. This one. This one. This one. This one. What about this line right here? Can you see this letter? What about this one? And this one. Oh, great. I want you to open your mouth. Okay, say ah. Do you have any sore throat? Okay, I want you to swallow for me. Swallow one more time. I'm gonna give a little pressure here. Swallow. A little pressure there. Swallow. Okay. Okay, a little pressure right here. Swallow. Well, I don't see any problem with your cranial nerves, so yes, you can go. Bye. Well, I'm not done yet. I want you to follow my light, please. Well, I'm not done yet. I want you to follow my light, please. Follow my light. Follow. Great, you're doing good. Follow my light. Follow. 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 You're doing good. Follow. Follow. Follow with one eye only. Follow with another one. With both. Okay. I'm going to put this here. Follow. You can follow the shadow. The shadow. Follow. A little tinier. Follow. Follow. I want you to follow the blinking light, the black one only. Look at the black one only. The black one only. Okay. Black one only. Black one. Black one. Black one. Okay. Look through the brush. Through the circle. If you got tired, you can close your eyes, no problem. Okay. I want you to look at the red one. Look at the red one. The red one. Hit the red one. Hit the red one. Great. Hit the brush. Close your eyes. Open. Okay, I'm gonna check your face. Okay? Here. You're gonna apply it all over your face, just like that. Well, so far I don't see any problem with your face, so let's anyway double check. Your cheekbone, your nose, mouth, cheek, temple, your forehead, area around your ears, around your ears. Okay. Don't be afraid. Looks sharp, but it's not. Just gonna feel something like that. We'll create a little red marks all over your face, and I would like to start with your forehead. In the middle of your eyebrows, that's gonna feel good, I know. Now we're gonna go all over your eyebrow, a little bit higher, and then we're gonna go up to your forehead, your hairline. Just like that. Like that. We're gonna go down to your temples, your cheek, bone cheek, cheekbone. Your apple cheek, cheekbone, cheek, apple cheek. Around your nose, we have to be very, very careful. Very sensitive skin right here. Just like that. Around your mouth as well. It's such a sensitive triangle there. Okay, your chin, jawline. And we're gonna make one more circle around your eyes. Not very close to. We are not touching the area right here. Let's go over your nose one more time. Forehead, your eyebrow, a little bit lower your temple. Eyebrow, temple, and your forehead. Forehead, we can be a little bit pushy. That's right. Okay, and your lip. Here we go. I would like to look how it looks. Okay, let's look at the light. Okay, redness around your eyes start to disappear. Redness around your nose start to disappear too. It's a very good sign. There's still a little bit of redness around your lip, but that's the last part we did, so we'll wait a little bit more. I like that the redness on your forehead still there, which is good. There is not a lot of fat under forehead skin. Okay, area around your ears looks perfect. Same here, looks perfect. Your nose, lips. Okay. Tell me if you feel a little bit cold or warm around your eye. Cold or warm? Okay. Cold or warm? Okay, around your ear. Around this ear. Okay. Your forehead. Okay, your cheeks. Cheeks. Your temples. Temples. Okay, your lips, you can do that. Your cheeks. And your forehead. Okay. Tell me if you feel this. Okay, this and that. Great. Feel it. Feel it. Okay, right there. And there. Okay. I want you to close your eyes just like that. Tell me, where do you feel it? Yeah. Where? Yes. Okay. Where? Yep. Where? Okay, open. you're beautiful no matter what. I want you to remember that. And now we are done. Bye.